Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about intraosseous adrenaline administration. Intraosseous adrenaline administration include, first we have proximal tibia insertion, that is, it is located at around 2 centimeters below the tibial tuberosity, 2 centimeters below the tibial tuberosity, and 1 to 2 centimeters medial in middle of flat surface of bone. Then we have distal. We can also put intraosseous adrenaline administration in distal tibial insertion. Distal tibial insertion is located 2 centimeters superior. It is located 2 centimeters superior to medial malleolus in middle flat surface of bone. Then if you see proximal humeral insertion, we can also give intraosseous insertion in proximal humerus insertion, which is located in the greater tuberosity. Thank you for watching.
Thank you and thank you for watching.